This is the Bartholomew Town Podcast.
Hey everybody, welcome into another edition of the Bartholomew Town Podcast. I'm Bill Bartholomew. Today we return to our recurring series, Inside Rhode Island Public Health, presented by Commonwealth Care Alliance Rhode Island. My guest today is Dr. Jim McDonald, the Interim Director of the Rhode Island Department of Health, for what I framed as a conversation on where we're at with COVID-19. You know what I mean? Which is completely different than where we were 6 months ago, certainly a year or two ago, obviously. So I wanted to get a sense of the Department of Health's perspective on things at this moment. Because, look, there's a lot of media reports out there that are suggesting we're seeing an increase in cases. There is renewed chatter locally about concern in certain pockets. I personally know some people who have had it and in the last week or so and have had monoclonal antibodies. And look, it's clearly an interesting moment where the pandemic is now an endemic and it has shifted outside of the general purview of our day-to-day lives. But we also have this sort of look over your shoulder approach where some voices are suggesting that it's not over and there's still some reason to be concerned or incorporate COVID into your planning in terms of events, in terms of whatever it is that you do in your day-to-day life. So I just wanted to check in with the Department of Health and get a sense of what's going on, right? I mean, not from like a fear-oriented standpoint, but just like, where are they at with it? How is this being managed? And how is this different in a significant way from where we were maybe 2 months ago? And there are some specific things in terms of metrics and how things are reported out and in terms of treatability and in terms of variants. So very pleased to have Dr. McDonald here on Inside Public Health. Remember, you can send me an email anytime, bill@ripodcast.com, or tweet at me at Bill Bartholomew. I'll be happy to take your questions and deliver them to the appropriate newsmaker or panelist as we move forward here in election year 2022. But for today, Inside Rhode Island Public Health, presented by Commonwealth Care Alliance Rhode Island. Inside Rhode Island Public Health is brought to you by Commonwealth Care Alliance Rhode Island. Commonwealth Care Alliance, or CCA, is a multi-state integrated care system influencing innovative models of complex care nationwide. CCA's Uncommon Care model focuses on sustainable and evidence-based healthcare breakthroughs that improve the health and well-being of people with significant needs, and is consistently recognized as one of the best models in the country at identifying and serving traditionally hard-to-reach individuals. CCA is excited to bring Uncommon Care to Rhode Islanders with a range of Medicare Advantage plans. To learn more, visit www.commonwealthcarealliance.org/Rhode Island. All right, so welcoming in Dr. McDonald, the person at the top of the Rhode Island Department of Health right now, and certainly someone who became a statewide celebrity of sorts during COVID-19's peak, if you will. And, you know, I think that the moment right now is an interesting one. There's certainly people who are becoming infected with COVID-19 still, people who are having monoclonal antibody treatments. It's still out there. At the same time, things have shifted in the way that the Department of Health is reporting COVID-19 and just the general public consciousness. So I suppose at this moment, Doctor, where are we at with COVID-19 in a very vague and general sense? What's your take?
Yeah, Bill, I think that's really where we need to land right now. Like, it's interesting. If I just bring you back a little over 2 years ago, we were dealing with this unknown, you know, and it was really this nebulous issue about this pandemic that's coming. And, you know, if you really think about where we were 2 years ago, it was about we were hoping for not many cases. We were hoping for maybe a vaccine someday. We were hoping for maybe treatment someday, but, like, that's where we were over 2 years ago. Where we are now is it's a preventable, treatable disease, and it's controllable. And, you know, in a nutshell, where we are now is where we wanted to land. You know, I would have preferred to have landed with much less cases, much less people in the hospital, much less people dying. But we're, you know, dealing locally and nationally with a preventable, treatable, controllable disease like every other disease that we deal with. This one just happens to be more prevalent right now than most. You know, so this is part of why we still talk about it, although admittedly, we don't talk about it as much as we used to. And I think sometimes people are just sort of tired of talking about the whole thing. I think part of the reason they're tired of talking about it is because it's all we talked about for 2.5 years.
Yeah, it's all we live with. Every single day, every single decision was tied to COVID-19. What's your advice for folks right now, as obviously things have returned, quote unquote, to a lot of normalcy anyway? There still are indoor events. I was just at an event at the Vets last week, and I noted, I was like, wow, this is the first time I've been here since the barrage of what seemed like 500 days in a row of press conferences inside the Vets. But really, no one was wearing a mask. There was no vaccine check, nothing like that. So are we really at a point where it's kind of okay to just go back to normal without having even to look over your shoulder in terms of COVID at all? Or is there something that people should be doing, at least in this moment where we're seeing a little bit of a resurgence in cases?
Yeah, I think it is interesting you talk about that. Like, it's interesting. Like, when I went back to places, too, it almost felt wrong to be walking in places without a mask.
Yeah.
And it just felt unnatural. It was funny. I remember once even just going into Whole Foods, and it was just so crowded, but it was just like, that was the first time I was back shopping in person. And, when I go to events now, it just feels a little odd. And so here's what, where we're saying, this is now an endemic disease. We're going to be living with this for the foreseeable future. So it's endemic, meaning we got to live with it, right? So you're going to see periodic, ups and downs of cases. I expect we're going to see another little peak in cases by May 21st. I think we're going to see an increase in hospitalizations by Memorial Day, but it's not going to be anything like what we've seen in the past. In other words, you're going to see it. It's kind of like being on a little kiddie roller coaster. There's, little ups and downs, but no thrills. And I think that's what the pandemic's going to look like. Our endemic plan is going to look like prevent, detect, and treat. And, one of the things we're talking about is how do you prevent, how do you detect, and how do you treat? And, how you prevent is, gosh, we want people up to date in your vaccine. That's where I am. Be in well-ventilated spaces, wear a mask when you need to. Like, as we see cases going up right now, like we will this week, you'll see me in public wearing a mask when I'm indoors from time to time if it's a crowded place. Like, I'm going to go to across the street at State House tonight at a testifying. There's a lot of people going to be there. I'm probably going to wear a mask when I'm not talking because I just don't want to be exposed. When we talk about detect of COVID, people need to remember that, if you're sick, you just don't go to work. You don't go out and do stuff. And, you get tested right away. We talk about treatment, Bill, this is a treatable disease. In other words, we want you to stay home when you're sick, but we also need to know that, Paxlovid's a drug. It works. It's out there. We got medicine for you that's a pill. That's not too bad. We still have the intravenous Dept, the monoclonal antibodies, but, this is a treatable disease. It's sort of like strep throat. You can get swabbed in your doctor's office, get a rapid result, and then get your prescription for penicillin, and, you go back to your life. And I think COVID's going to become like strep throat. It's just a regular disease where we live with it. And admittedly, some people are going to end up in the hospital. Some people are going to pass away. It's obviously more serious than strep throat, but the infrastructure to treat it, is building and getting back towards normal. And so one of the things I'd say to people in Rhode Island is, if you want to go back to your life, I'd go back to your life and try to do what you can do, and just, look like, hey, am I up to date with my vaccine? Maybe I should carry a mask with me if it's a crowded space. If I have symptoms, I shouldn't be going outside. I should get tested. And you know what? If I do get COVID, I'm just going to see if I can get some treatment for it. That's how I'm living with it.
In terms of the reporting mechanics, there was a shift a few weeks ago where percent positive was no longer going to be reported. That's probably, I'm guessing, to do with the fact that many people are using at-home tests or not testing at all. Things have shifted in that sense. What's the best barometer for people to look to in terms of just being aware that, hey, this might be a moment where things are spiking? A lot of people have, for whatever reason, come to distrust media reports. And so is there any public health metrics that people should be aware of?
Yeah, we did stop publicly reporting percent positive for the reasons you said. There's so much home testing, and there's, we're only testing symptomatic people now. It just wasn't a reliable number anymore. So the case rate is still something you can use as a barometer. When it goes up, there's obviously more cases. When it's going down, there's obviously less. But it's one of those things where we still know we're not having as many cases that we're capturing because a lot of people are doing home testing. I look at the hospitalization numbers. To me, that's the barometer that I track. And I look at people, in the hospital with and those from COVID. Because sometimes people are just there because there's cases in the community. Some people are admitted just because, they actually have COVID. And our hospitalization numbers lately have been pretty good. I expect they're going to go up over the next couple of weeks, but I think we're going to be able to handle it as a system. But part of why I follow the hospitalization numbers is that's something that I can consistently follow from the beginning of the pandemic to the worst part of the pandemic and Martin Luther King Day of 22, and even to where I am now. So the hospitalization numbers are what I look at.
Last area here, and I guess it's somewhat interpretive. Now that we're at this point, I remember there was a day where I asked Governor Raimondo, do you ever think you're going to walk out on this stage and say, folks, the pandemic's over? We can move on. We may never have that announcement, obviously, because we're in endemic form. The semantics are that the pandemic's over. But how has this changed your approach to public health in general and in terms of communicating information the last two years and change? How has it kind of re-informed the way that you are looking at this broad area of public health?
Yeah, it's interesting, Bill. The pandemic wound down a little bit anticlimactically. That there was no party, no celebration, and no one came out and said it's done. On the other hand, we moved to the endemic state, and it really wasn't any announcement about that. It just happens. But I think when I think about how we deal with the public now, one of the things I think about, Bill, is that the public's different now than they were 2.5 years ago because the public went through a shared population trauma. So one of the things I'm just very cognizant of is that when I talk to the public, I'm dealing with people who've been through a shared population trauma. I live in a state with 1.1 million perceptions, and perceptions are purposely personal. And the reality of it is, as people have gone through this shared population trauma, they're all coming through it with their different perceptions. So part of what I'm trying to do is I try to explain things as honestly and simply as I can, tell people what is known, also what is unknown, and then kind of just give common sense advice about where we're going forward. But one of the things I'm very cognizant of, and this is something that kind of worries me a little bit, is that the public has a lot of voices in their ears, and I think the public is having a hard time understanding who's the voice of truth and who's the voice of a hidden agenda. Because quite frankly, I want to be a voice of truth, but there's many voices of hidden agendas out there. And this is one of those things where I think it's actually a threat to the public health, is people, just hearing, voices where people are trying to manipulate them. So that's part of why at the Department of Health, I really try to be a voice of truth, give people best advice I can, and we work together to solve problems.
Dr. McDonald, Rhode Island Department of Health, always a pleasure, and congratulations on navigating us to this point of renewed outlook on COVID-19 as compared to certainly a year ago or certainly 2 years ago. No question about it.
Thank you, Bill. Have a good, keep up the great.
Rhode Island's podcast of record, B-Town.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.